Hi, this is Dr. Schlaff here. I am a pelvic floor physical therapist and health coach, and I am going to talk about your pelvic floor muscle anatomy, where the heck it is, what it does, what it looks like. So I think it's really hard to visualize the pelvic floor because it's not just like your bicep. Like your bicep is on your body. You can look at it, you can see it's stretching, it's relaxing, it's contracting. So I always like to show the pelvis. So here is my pelvic model, and just to orient you, we've got hip bones in the front, the spine in the back connects back here, and then these bones down here are your bony sit bones. So there's multiple different muscles in the pelvic floor here. If I come to the bottom of our pelvic model, we can see the muscles at the opening here. So we've got superficial muscles that are supporting these external structures, including circular muscles around the anus and the urethra as well. If you go a little bit deeper, you can see your deep bowl-like pelvic floor muscles. So these are what people are talking about when you hear someone talk about a Kegel. And I will show you from the top here. They work really closely with this hip muscle. So your pelvic floor and your hips and your pelvic floor and your back are incredibly connected. There's actually a study published last year that found that 95% of people with low back pain have some kind of pelvic floor dysfunction, which is crazy and amazing because we talk about that all the time. Anyways, so if we go a little bit deeper inside here, you take the pelvic bowl out, you can see that these muscles are perfect for holding our organs. So we've got bladder, uterus if you have one, and rectum. And you can see back here, your pelvic floor actually attaches to your tailbone. So we have this incredibly connected system in the pelvis. We've got organs, we've got muscles, we've got bones that are connected here. And your pelvic floor has a lot of different things that it does. So it needs to be able to contract to work as a part of our core. We know that 95% of people with low back pain have pelvic floor dysfunction, and it's because your pelvic floor is actually the basement of your core. We also need to be able to contract rhythmically to generate an orgasm and to generate force and support our bladder and support our bowels. And when we don't want to go to the bathroom, it keeps our poop in and it keeps our pee in. When we do want to go to the bathroom or have a baby or have sex without pain, those muscles need to relax and possibly even lengthen. So just like any other muscle in our body, we are contracting, relaxing, and lengthening. So that is kind of the basics of the pelvic floor. And when you think about how this interacts with the body, I always like to talk about the diaphragm. So pelvic floor sits here, your diaphragm sits on top of your pelvic floor underneath your rib cage. So as you're breathing in, your diaphragm lowers and it pushes the pressure in your abdomen down so that your pelvic floor actually relaxes and lengthens. Think of this like a trampoline. So if you were going to jump on a trampoline, you would have to relax and lengthen down before you could jump back up. So that's kind of what the diaphragm and the pelvic floor are doing. So they're relaxing and lengthening to jump back up, load to explode. So we need both pieces of the puzzle to have a functioning pelvic floor. If we are super tight in our pelvic floor muscles, that connection is going to be impaired and you're actually going to lose some of your strength and some of your power. A lot of people think if I'm tight, I'm strong. But if you're tight, then you can't go through that whole trampolining motion and you can't load to explode. So it's kind of like instead of jumping on a trampoline, you're jumping on like a concrete surface. So the best way to reconnect to your pelvic floor and your diaphragm is through diaphragm breathing. So I really like to teach this super simply. Just put your hands right on the sides of your rib cage. As you breathe in, you should feel your diaphragm kind of open and expand to the sides. I think that a lot of people are good at breathing with their bellies or breathing with their chests. We're really thinking about how can we bring that expansion all the way through the rib cage. So as you breathe in, you should feel your diaphragm open, your ribs open. So right? Even practicing this 5 or 10 minutes a day can have huge benefits. So pelvic floor wise, it's mobilizing the pelvic floor tissue, it's bringing blood flow to that tissue, and just whole nervous system wise, it's shifting you from that sympathetic nervous system fight and flight to your parasympathetic rest and digest. And so the fight and flight nervous system, that's where pain lives. So if you do have any low back pain or pelvic pain, breathing in this way is going to help shift you out of that sympathetic nervous system into the restful kind of nervous system relaxation and bringing blood flow to your tissue, and it should help. All right, have a good one.